In this course, we are going to have a series of lecture in public health, and in order to explore the definition of public health, what are the disciplines in public health, how public health differs from other discipline in medicine, and to explore the role of public health physician in improving and maintaining the health of the population. So the main objectives of this course is to explore the major concept of public health, to educate people about the different disciplines used in public health on a local, regional, national, or global level or environment, to explore the role of public health physician in planning, implementing, and evaluating different health programs, to prepare these medical students or enable him to carry out different studies in different medical fields. Also, prepare the students to be involved in different health or different types of health services to promote health and prevent disease. So, the public health education prepares students to contribute to the health of the public through positive decision making and constructive action. After the completion of this course, so the student will be able to explain the history and the philosophy of public health, to identify the methods and tools of public health and data collection and analysis and the plan of health services. Also, to identify the basic process or approaches or interventions to improve or identify the health related need and improve the health of the people, to plan health services in order to promote and to protect the health of people, to identify the socio-economic or behavioral factors or biological or environmental factors which affect the health of people, and lastly, to apply public health specific communication in order to improve the health of people or promote health. So, public health have different definitions, but the first epidemiologist or scientist who defined public health was Winslow, who defined public health as the science and art of preventing disease, prolonging life, and promoting the health of people through organized effort. That was in 1920, and he meant by these efforts that include control of infection, sanitation, health education, and the provision of health services. At that time, the most important cause of health problem was infectious diseases, which are related to sanitation and to hygiene. So he concerned about how to control this infection by improving the sanitation by health education through the provision of healthcare services. So public health maintain deal with the maintenance and improvement of sanitation, cleanliness, and personal hygiene. At that time, as we mentioned, the main concern was about the improvement of the hygiene and sanitation of the people. The sanitation at that time include disposal of waste. The waste produced from toxic and infectious material. So it is important to dispose this waste because it is related to the health of population. This waste included organic or domestic waste from everyday living. There are different types of domestic waste from the houses, for example, or food which are used by the people, agricultural waste, other industrial waste or which cause pollution, and sewage, which is the main source of diseases and infection. Another important sanitation aspect is the provision of safe water and food. Water was source of diseases, and food also they were regarded as a source of diseases. So it is important to have safe water and food. In addition, it is important to concern about provision of safe environment. Public health have different definition in different countries. So the Institute of Medicine simply have or defined public health that what society does collectively to assure the condition for people to be healthy. So the main concern was about the collective conditions which are used by the society to improve the health of the people or to be healthy. While public health definition of public health, they define public health as with the main aim to provide maximum benefit for the greatest number of the people, while export expo of public health define public health as the process of mobilizing and engaging local, state, national, and international resources to assure the condition in which people can be healthy. That means how can we use the available resources and mobilize it in order to improve the health of the people as a whole. The public health approach differ from the medical approach. Usually, as a doctor, we are dealing with individual patient and concerning mainly about the diagnosis of the disease, treatment of different health problem by different interventions, whether medical intervention or surgical intervention. This was called the medical model. While the public health model, we are dealing with a population as a whole in order to prevention of the disease, promotion of health of the people, and by interventions which are mainly concerned about the environment and the human behavior in order to improve these two aspects, improve the environment and improve the behavior of the people as a whole in order to prevent the disease and to protect them from different types of diseases. So the public health is concerned about the threats to health. What are the threats to health? Whether they are social behavioral factors or the environmental factors which can affect the health of the people or regarded as a threat to people, and how can we detect these threats and how can we deal with these threats to prevent the occurrence of disease and improve the health of the people. Public health involve different disciplines. All together they are work in order, they are integrated together in order to improve the health of the people. These disciplines include epidemiology, which concern about the occurrence, distribution and determinant or the factors which affect the health. Biostatistics, which are how are we going to use the data available in order to detect the health problem and analyze it to improve the health services. What are the environmental factors which affect the health, the behavioral factors which affect health, health economics and health policy, which we have already dealt with this subject in the last year. What are the school health services, maternal health care services, the control of communicable and non-communicable disease, occupational health, all these, or nutritional medicine, all these discipline, they are worked or integrated together in order to improve the health of the population as a whole. So they are integrated disciplines in order to improve the health. Public health professionals analyze the effect of health of genetics, what are the genetic factors which affect the health of the people, how can we prevent these genetic factors by screening, for example, and how can we detect the personal factors or behavior which affect the health of people, and how can we improve these behavioral factors in order to improve the health of the people, what are the environmental factors, and what are the programs which are going to be implemented and to protect the health of the people. So overall, public health is concerned about protecting the health of the entire population, whether it is a small population or large population. So the sum of the all official governmental efforts to promote, protect, and preserve public people health, that is the main concern of public health. So public health professionals try to prevent problems from happening or from reoccurring through implementing educational program. There are large number of educational program on different levels, starting from nursery until later in life at different age groups or different places. Also, by developing health policies, we have large number of example of health policies which are implemented to improve the health of the people. By now, you can give different examples of health policies. For example, the health policy, for example, the addition of iodization of salt in order to prevention of hyperthyroidism, or fluoridation of water in order to prevent dental caries, vaccinations, or improving the health, environmental factors, seat belt. So there are large number of health policies. You can have large number of examples and on this aspect. Regulating health system, different aspect in healthcare system. How can we plan, implement, and evaluate health care system? Also by conducting different research in different fields in medicine. So it is also the field that is concerned with limiting health disparity. One of the global problems is the difference in the health status in the population, whether local or global difference. So it is important to decrease the gap or the difference between the health level or health status in the population, and this is by providing health care according to the equity and the quality and accessibility of the healthcare services. There are different terms used, such as public health, community medicine, social medicine, or preventive medicine. All these are interchangeably terms which are used, but there are two basic concepts in this issue: public health on one side and the community social or preventive medicine on the other hand. The latter three, that means the community social or preventive medicine, they are terms have different historical roots but reflect more or less identical orientation. All of them, maybe there are different terms but have the same concept. Community social or preventive medicine are considered to be subdivision of the overall discipline of the medicine. So the common denominator of the all three, it is the term medicine, while the concept of public health, the main activity is concerning about the health of the people rather than medicine. Preventive medicine defined as the art and science of health promotion and disease prevention, mainly concerned about promotion and prevention. And by the definition of a preventive medicine is applied to healthy people, and its primary objective is preventing of the disease and promoting health. Healthy people in a healthy community. While social medicine, it is dealing with the social factors, the study of the social factors which related to the etiology of the disease, or the study of the determinant of health, which are mainly concerned about the behavior of people in determining their health, whether they are healthy behavior or unhealthy behavior. While community medicine became prevalent in the United States as a substitute of social medicine, since the later term sounds too much like socialism. How public health differs from other branches of medicine. Public health reaches out the people. It is concerned only for reaching the people on different levels. Those people who cannot consult healthcare services. So by public health, we are going to catch these people who cannot come and use the healthcare services. So the public healthcare services concern about to provide services and for prevention of disease such as immunization, prenatal healthcare services, and health screening, and also promotion of health by using safe water, supply sanitation, vector control measures. There are large number of vectors which are regarded as a cause of disease, so it is important to control these vectors and controlling the diseases. Also, the use of tobacco control policy. Also, concern about the provision of the primary medical care and treatment of different health services such as diarrhea, pneumonia, tuberculosis, leprosy, malaria, or hypertension. So, as a public health provision, they are not only concerning about the prevention but also treating certain health problem such as respiratory infection and diarrheal diseases. Whereas all other branches of medicine largely provide diagnostic and treatment treatment of patients who seeks the hospitals or different health institutions. The concept of healthcare approach has experienced dramatic changes. In the past, we are concerning about treatment of infection or diseases, or treatment of disease. But now we are concerning about how to improve the quality of health in order to prevent the occurrence of disease. So health is concerned as a means of productivity, how the healthy individual can be productive. Even sometimes some individuals they have disease but they can be productive, they can produce and earn and improve their economy. Thus health development is essential to socio-economic development as a whole. If we have healthy people, so we have a healthy condition, and we can develop in our contribute in the development of our country. So the scope of medicine has extended from individual to the community. Rather than we are dealing with an individual patient, we are going to deal in the community as a whole. So a study of the health and disease of the population, replacing the study of disease in man. Rather than studying or concerning about one individual, but we are going to concern about the health of whole population. So the modern medicine is no longer confined to the treatment of disease, but also for the prevention of the disease, not only in the individual patient, but in the community as a whole. So it is also the science of preventing disease and the promotion of health. So the technical sophistication of modern medicine There are large technical sophistication using of different techniques in the diagnosis of the disease, but this will not it is also we can elaborate the use of a cheaper intervention in improving the health of people. So we are not only concerning about or the use of different technical procedure in the diagnosis of the disease, but also we can use simple procedure in the treatment of certain health problems, such as the oral rehydration therapy, which is used in the maintaining the hydration for dehydrated children in order to prevent dehydration, which was the main cause of death and diarrhea. So it is important we have to elaborate the role of this treatment in the prevention of decrease the mortality in patients who have diarrhea. The use of immunization, which have been started the previous century, it changed the mortality from different infectious diseases and the morbidity, and it is regarded as one of the life-saving measures when for the population. So the physician role is no longer confined to diagnosing and treatment of some individual who came to the clinic, but it extended to the community for those people who cannot come to the hospital or to the clinic. So it is also the public health concern about increasing or elaborating the role of people and participation of the population in improving their health. So we give a role for the people to how to participate how in improving their health and improving or protecting their health. So the new idea and concept, for example, increasing the importance given to the social justice and equity. So it is important to have the same health services for all the population. So social justice, which means that all the people have the same right in having good health services. So if we achieved the social justice, that means we decrease or eliminate the health disparity which we have mentioned before. Also, it is important to recognition of the role of the community in participation and to give them a role to participate in improving their health. So this called the new approach of medicine is called it is more effective and improving the humanity. And the first thing was applied in Alma-Ata Declaration in the year 1978 by improving or providing or the provision of the primary healthcare services, and this Alma-Ata Declaration was implemented at that time in order to provide social justice by providing primary healthcare services. That means all the people have the right to be provided with the primary healthcare services in order to promote their health by implementation of different health services at the primary health care. So the primary healthcare services was stressed at that time, and it was regarded as the essential health services, which should be made universally accessible. That means all the people can use or reach or have an access to the health services, and this health service should be acceptable by the people. That means all the people accept the use of this healthcare services by, and also they should have a role in the or have full participation in the healthcare services, and also it should be affordable or provided by affordable price for all the people so they can use it all the time. So the main criteria of the primary healthcare services should be essential, which include different types of health services. Essential health services accessible, that means they can use it when they need it, and acceptable, it means they are accepted by the population, and it is affordable, which is at a low cost or free of cost, and we give a role for the people to participate in the healthcare services. So the main branches of the public health include the behavioral science, or by using the health education. So it is important, in public health we focus on the study of the behavior of a human which affect the health of the people. Large number of behavior affect the health of people, whether they are healthy behavior or unhealthy behavior. For example, on the healthy behavior, that how can we have good behavior in order to have a good health, such as physical activity, or having a healthy diet, for example, or stop smoking, having a good lifestyle. So all this factors regarded as a healthy behavior, and you can give a large number of examples of healthy behavior. On the opposite side, there are unhealthy behavior which can affect the health on the negative side, such as smoking or lack of physical activity or having unhealthy diet. So it is important to focus on the behavior which affect the health of people, and we can improve the behavior of the people by health education, by having different educational program at different levels or different age groups, in order to promote healthy lifestyle, in order to prevent diseases and injury. For example, stopping the spread of communicable diseases by health education of mothers during the maternity and child health, how to use the vaccination for their children in order to stop the communicable diseases, or also provide different education program to prevent, for example, sexual transmitted diseases, or prevent different gastrointestinal or respiratory infection. By now, at this time, we have the problem of coronavirus or COVID-19. So we have different programs which you have already dealt with, and we have discussed that and how to prevent the disease. And also it is important to provide people about different aspect, to know different aspect about danger, such as how to prevent, for example, injuries, or by using or promoting or decrease the effect of trauma, such as promoting the seat belt use in the car, or prevent the drug use and smoking among school children. Also, it is important to improve or promote health by providing or adopting self-care practices. For example, having different hygiene program, how to improve the hygiene of the people, and promote people to use the different health services which are available, health services such as antenatal health care services for the mother, and in different aspect of life. Biostatistics, it is one of the discipline used in public health, and it is one of the important disciplines which are how we are going to use the available data or health related data, in the how we are going to take these data, analyze it, and in order to detect the health problems, the needs of the population, and how can we improve or we detect the deficit in the healthcare services, and how can we propose other factors in improving the available healthcare services. So by the biostatistics, how can we use the data which is available in order to detect the gaps in the healthcare services, and to promote or to plan a new health services to improve the healthcare according to the need of the population. So it is important to it is important to for comparison in the health trend. What is the health status now compared with the previous healthcare services? By the biostatistic, or by the use of this data, we can compare the different types of health problems in the past and in the current status. So it is important to detect the difference, and how can we improve that. So biostatistics, it is synonymous with the epidemiology, by using the numbers in improving or detecting the health problem in order to improve the health status. Environmental health, one of the important discipline in public health is how the environment affect the health of the people, and how can we prevent the effect of the environment on the health of the people. So the environment involve or include the effect, for example, air pollution. What are the factors which cause air pollution, and how can air pollution affect the health of people, and how can we prevent this air pollution? And what are the effects of water on the health of people, and how can we improve the water or provide safe water for the people? What are the effects of radiation on health? What are the effects of noise on the health of people? So all these factors can interact and affect the genetics of a human, and cause many genetic factors, and affect the health of the people. So it is important to study the environment, and how can we improve the environment of the environment of the people, in order to detect the risk factor which cause diseases, and how can we prevent it, and improve the health of the population. So environmental health studies the impact of our surrounding on health. These areas include, as we mentioned, the quality of air, water, food, because all of these together, it affect the health, or regarded as a cause of different health problems. Radiation, and how to the effect, we are going to study the effect of the solid waste by provision of different programs. How can we manage the waste in order to prevent the effect, or different hazardous waste, the effect of noise, and environmental control of recreational area, and also by providing or having a good quality for the house, and control of vector control, which there are large number of vectors which can which have a role in the transmission of a disease. So it is important to have different programs to eliminate or eradicate these vectors. The epidemiology, it is one of the important discipline in public health, and it is involved in detecting the causes of the diseases, and promoting programs in order, or investigate the cause and the mode of transmission of the disease. So they are the epidemiologists concerning about determining what are the causes of diseases or injuries, what are the risk factor, and how can we prevent the occurrence of these health problems. Also, it is they concern about the role of the demographic or social factors and in the causing of the disease or causation of the disease. Also, they are concerned about to detect the cause of the outbreak of any disease and how can we containment it or how can we control this epidemic or pandemic, such as what we have now, which is the pandemic of COVID 19, and how can we control this pandemic all over the world. Also, it is concerned not only about infections but other factors which related to the occurrence of disease and how can we modify the behavior of people in order to decrease the effect of, for example, tobacco smoking, and it is synonymous to biostatistics. Global health or international health. This is by this branch, we are going to understand what are the global differences between the health status of the population in different countries, and how can we decrease this the gap or the decrease the disparity by implementation of international health policies or health programs in order to decrease this disparity. And by globalization, it linked the people to or different populations to make it they are very closely related in order to decrease the disparity. And this is by improving the different health program which are used globally or by internationally. Maternal and child health, they are one of the most important health discipline in public health, which concern about the health of the mother during pregnancy, before pregnancy, and after pregnancy, and concerning about the family planning in order to improve the health of the mother in order to have healthy child. If we have healthy mother, so she will give to a healthy child, and we are concerning about the health of children. So all this they are provided by maternal and child health care services, which provide different types of healthcare services during maternal and child health. By follow up of the pregnant mother during pregnancy to assure that she is healthy in order to prevent any health problem during pregnancy, in order to assure that we are going to have a healthy child. Also, during maternal child health, we are going to provide mother with the family planning services, family planning education, and also we give her education about the vaccination, or how to about the children, how to take care of her children, and also by a detection of high risk pregnancy. During pregnancy, there are large number of mothers who have high risk during pregnancy, so which are concerning about the health of the mother and the child. So it is important to detect the high risk pregnancy, and such as, for example, mother with RH factor or RH incompatibility, which are regarded as one of the causes of health problems in a newborn or in the unborn child. So the main aspect in it is important to provide a good maternal and child health in order to assure a healthy mother, she will have a healthy child. Nutritional medicine, it is important to have or study the effect of nutrition on health. The nutrition is regarded as one of important factors in affecting the health of a human. So it is important to elaborate what are the nutritional factors which affect the health of human, what are the diseases related to nutrition, and how can we improve the nutrition of people in order to prevent the occurrence of nutritional diseases. For example, malnutrition, it is one of the diseases common in many countries which affect the health of people, especially children. So it is important to have good health, good nutrition in order to prevent malnutrition. Malnutrition involve undernutrition and overnutrition. So undernutrition, it is one of the example of the diseases which are related to the deficiency of nutritional factor, while overnutrition, it is, for example, obesity. It is regarded as one of the recent public health epidemics, which is related to large number of diseases, and it is important to prevent not only undernutrition but also important to prevent overnutrition. Public health laboratory practice. There are special laboratory which are concerning about the detection of certain bacteriological factors or microbiological factors which are or biochemical factor which are concerning about the or dealing or sorry which have a role in the occurrence of certain diseases. For example, detection of different microorganisms which are related to diarrheal disease or respiratory disease or the different types of infectious disease, and also the biochemical problem, not only the microbiological factor. So in order to ensure this laboratory is important to ensure the safety of the food, water, and the air which we are going to consume, and also it is important aspect in public health. There are large number of public health policies which we have already discussed previously. For example, the impact of the seat belt law on traffic deaths. The seat belt law does not prevent accident, but it decreases the effect of the trauma or the accident. So it is important to implement this law in order to decrease the impact of the car accident, for example. So another health policy is the implementation of a smoking prevention policy. There is which is regarded as an international policy where for the prevention of smoking in the public places, in restaurants, in the airplane, in the buses, and in different in the work during different occupational offices. So it is important in order to decrease the risk of nicotine on the people. Also, there are another policies that are iodization of salt or fluoridation of water in order to prevent hyperthyroidism or the dental caries. Provisional and public health policy work to improve the public health through legislative action, local or and different level.